Can stress lead to cancer? Scientists have long struggled to identify the underlying cause of most cancers. Many cancers have been linked to unhealthy lifestyle choices such as smoking, excessive alcohol consumption, stress, and a lack of physical activity. The link between stress and cancer is one that is frequently overlooked. When you are stressed, your body goes through a series of temporary physiological changes. Everything returns to normal after the stressor has passed. However, prolonged stress can cause long-term changes in your body, increasing your risk or even precipitating the development of certain medical conditions. Your emotional and physical health are intertwined. As a result, emotional health issues can manifest physically in some cases. This video investigates the relationship between stress and cancer, as well as the extent to which stress should be considered when determining what causes cancer. Can stress lead to cancer? There is little to no evidence to suggest that stress causes cancer to develop. When you're stressed, however, it's more difficult to take care of your body and health. When people are stressed, it is also common for them to develop unhealthy habits as coping mechanisms. To cope with stress, people may engage in behaviors such as smoking, binge eating, and excessive alcohol consumption. All of these behaviors have been linked to cancer development. Your immune system can be weakened by stress. One theory on the link between stress and cancer is that your immune system is weakened, putting you at a higher risk. The research on the relationship between stress and cancer is contradictory. Living with chronic stress for an extended period of time may compromise your immune system. Your immune system's function is to protect your body from diseases and infections. A weakened immune system may increase your risk of developing cancer. Researchers concluded in a 2017 study on the effect of workplace stress on men with prostate cancer that there was a link between prolonged workplace stress and an increased risk of developing prostate cancer before the age of 65. Some research suggests that stress may promote the spread of cancer in people who have it, particularly those with breast, ovarian, or colorectal cancer. When you are stressed, your body produces more hormones, such as norepinephrine. These hormones are thought to promote cancer cell growth. Cancer could reappear due to stress. While it has been established that stress does not directly cause cancer, some research suggests that stress can cause cancer to recur even after years of remission. The studies to support this claim have been inconclusive, and scientists in most cases have no idea why cancer recurs after successful treatment. Numerous animal studies have demonstrated a direct link between stress and cancer. However, no conclusive human studies have been conducted. Is it possible to diagnose your stress level? There are two types of stress: chronic stress and acute stress. Acute strain. This type of stress is transient. It happens when you are late for the bus or are suddenly thrown into an argument. Chronic stress is a type of stress that lasts for several weeks or even months. Long-term stress is another term for it. Anxiety, nausea, difficulty concentrating, and weight changes are all symptoms of chronic stress. This type of stress can be harmful to your health. Your doctor will ask about stressors in your life and how you respond to those stressors when diagnosing chronic stress. If you display signs of excessive stress, chronic stress is not diagnosed using any medical or diagnostic tests. However, if your healthcare provider suspects you have cancer, they will usually order a series of screening tests such as blood work and imaging tests, followed by a biopsy to confirm whether or not you have cancer. A biopsy is the removal of a tissue sample from the area where the cancer is thought to have originated. A pathologist examines the tissue to determine whether or not it contains cancer cells. How does cancer get treated? Cancer treatment comes in a variety of forms. Chemotherapy is the most common. Chemotherapy is a treatment that kills cancer cells in the body. Certain cancers may also necessitate surgery to remove growing tumors in specific body parts. Ways to deal with stress and cancer. It has not been proven that finding healthy ways to cope with stress or eliminating stress from your life can prevent cancer. It does, however, guarantee that your body and its immune system are always in peak condition. You can't always avoid stressful situations, but you can learn to cope with them. Some excellent stress relief strategies include yoga and meditation practice. According to some studies, yoga and meditation can help you cope with stress. You don't need to be an expert in either to get started. Following beginner-level, guided yoga and meditation videos on YouTube is an excellent place to begin. Speak with someone. The source of people's stress is frequently emotional and personal. Getting rid of your stressor becomes more difficult in this case. Speaking with a psychologist can help. A psychologist will teach you how to manage your stress. Get enough rest. Stress and a lack of sleep can create a vicious cycle. You are stressed, so you have trouble sleeping. However, because you can't sleep, you remain stressed. Set a bedtime and put away all blue light-emitting devices to promote restful sleep. Stress has a negative impact on your body and its immune system. Adequate sleep also allows your body to heal itself. Numerous studies have been conducted to investigate the relationship between stress and cancer. However, no human studies have been able to conclusively demonstrate that stress is a direct cause of cancer. Stress weakens your immune system and may lead to the development of unhealthy coping mechanisms such as smoking and binge drinking. Stress is an inevitable part of everyday life, and it can be difficult to avoid stressful situations in many cases. However, it is critical to avoid chronic stress. Chronic stress stresses your body for an extended period of time. The overall effects on your physical and mental health are far-reaching, and research into the role that stress plays in the development of medical conditions such as cancer is still ongoing. Being stressed from time to time is usually nothing to be concerned about. Cancer is a difficult condition, and receiving a diagnosis can be stressful. Maintaining control over your stress can aid in your recovery.